Many of us work hard to keep our skin looking younger and healthy. Our guest today is Dr. Dore Gilbert, my very own dermatologist. He is the medical director of the Newport Dermatology and Laser Associates in Fashion Island. He's here to take the mystery out of Botox cosmetic treatments. Welcome, Dr. Gilbert.
Thank you for having me.
Dr. Gilbert, thanks for coming. You know, there's supposedly 3.5 million Botox injections a year. I mean, 3.5 million. I know you're very busy, but who's doing the other 3 million? Somebody's doing them, and I understand there's Botox parties, or people are doing it not in a doctor's office, non-physicians are doing it. What should be the standard of care? It kind of worries me that they're being done anywhere now. And can you give me your take on who should be doing these tests?
Absolutely. Yeah, I think that if I were a individual who was seeking out Botox, I would want to see a physician who is either been highly trained, probably going to be a dermatologist or a plastic surgeon. I don't think I would have a paramedical person doing the training because their expertise is not in, let's say, facial anatomy or how the nerves work. They've taken maybe a one-day course, so they're not you're not really seeing the person who's devoted to the study of the facial complex of nerves and muscles.
I would think that some of the problems, I mean, there could be infections. What are the complications that you can get with Botox?
The complications that I see in my office from patients who've been treated elsewhere is usually Botox that's been put in the wrong place. So if a patient wanted to have their glabellar lines, those are the lines between the eyebrows, treated, they come into my office, they may have a forehead that doesn't move, or their eyelids are drooping because the Botox was not placed properly.
Well, as I mentioned earlier, Dr. Gilbert is my dermatologist, and recently I had a Botox treatment from Dr. Gilbert.
Heidi, how are you?
I'm well, thank you. How are you?
So we're going to do a little Botox today?
Yeah, a little Botox.
Come on in here.
Are we going here?
Right here.
Okay.
Yeah. Probably of all the cosmetic procedures that I do in this office, I think that Botox is the safest thing we do. There is no cream that is sold at this time anywhere that gets rid of wrinkles, okay? What the creams do is they moisturize the skin and they make the skin look better, or they cause tissue swelling, and that makes the wrinkles go away, but they really don't, because the moment you stop, the wrinkles come back. So we're just cleaning off the skin with a little bit of alcohol because we don't want to introduce anything into the skin when we're doing this. And now we'll start right here in between. And for those of you that are watching, if you don't have a weak stomach, this is a pretty simple technique to do, and it hurts a little bit, but not too bad. Now when I do this technique, I just go very superficially and right through the eyebrow, and we inject only half of one of those little numbers, so that's 2 units of Botox. And then we'll just slide the needle in, same thing, and just inject the rest. And now we're done. And it'll take about 3 to 5 days for this to really reach its maximum effect. And then when Heidi tries to frown, she just won't create that deep crinkle there. It just won't happen.
I mean, it seems simple and quick. Was it painless?
No, it was quite tolerable. You know, there was hardly any pain at all. And I cannot even imagine someone having this type of procedure at a Botox party in their home or going to the mall to get this type of treatment.
It's amazing to me as well. Botox parties usually have alcohol served at the party, and people are making medical decisions, and they've had a glass or two of wine or champagne. that would be medical malpractice if you came into my office and I was offering wine and champagne prior to an injection.
Aw, shucks.
Yeah. So,
I was looking forward to that too.
It's just one of those things where you've got to come to the office, you got to find a place to park, you got to take the elevator up 8 flights, and suffer through all that. Listen to people talking on their cell phone in the elevator. It's all part of coming to the office, but you know it's done correctly. It's done with the proper technique and without alcohol.
Now, how much is it per site, and how many sites on a person's face can one safely have Botox administered? Safely,
we typically can use up to about 100 units of Botox on a patient, but it's rare that we do. Sometimes men with very large foreheads and big thick wrinkles may need 100 units. But typically, if a female comes in, she's going to have anywhere from 24 units up to maybe 80 units of Botox, and that would cover most of the upper face. Botox is used basically from the orbit up, and fillers are used from the orbit down. So when we're doing, let's say, crow's feet, we may use 28 units of Botox. The glabella may be 24. A forehead may be anywhere between 20 and 24 units. It depends on the area that we're treating. Cost is usually based on per unit of Botox that we use, and that's going to vary from community to community. It also varies if you're doing multiple areas, if you're bundling it with other cosmetic procedures, for example, if you're having photofacial or laser treatments. All these things factor into the cost.
Factor into the cost. You mentioned men. What percentage of your patients are men who get a Botox treatment?
About 25%.
25%?
Yeah, that's a big number.
That is a big number. What age group, roughly?
Men, it starts at about 40 when they want to grow the goatee and buy a motorcycle and have a crisis. So that's when we start to see men coming in. Women start a little bit younger, 30, then at age 40 they're coming a little bit more frequently. At age 50 we see that's where it really picks up steam, and then 60 it starts to drop off a little bit.
So I'm steaming now,
You're it.
I'm on a roll.
How many men admit that they have it?
That was going to be my next question.
How many of them admit that they have it?
Well, very few people admit that they have it. And that's one of the beauties of Botox, is that you can come in, have the injections, and then you're off. And nobody knows that you've done anything. So it's probably the safest procedure I do that gives instant, within a few days, results, and nobody knows you're doing it. So it's a great procedure and safe.
It's just the fountain of youth.
Well, it's getting there.
Now, how many times a year, a week, a month, what is the time differential between treatments?
Most people are going to be at 3 to 4 month intervals.
3 to 4.
There are some people who can extend it out a little bit. But I think it's also very important when the patient comes in for their Botox that they actually see the doctor with the box with Botox cosmetic on it. I mean, this is important because you don't want to, unfortunately I should say, there are some offices where they don't use real Botox.
Really?
And there has been some serious problems with that. So make sure that this is what you're getting.
When you do this, are there any modifications that somebody with more skill may have that will make it last longer, or maybe get you a better result?
Yes, proper placement. So for example, if we're doing glabellar lines, you're going to want to treat the procerus muscle and the corrugator muscles, but some people wrinkle from mid-eyebrow. That's where their wrinkle starts from. So you want to make sure you get it there, otherwise they're going to continue to wrinkle. But if you don't know how to properly place it there, then it may droop down, it may go down into the upper eyelid, and then you might get some droopiness. So again, it's very important that whoever is doing your Botox is very well trained and has been to many, many conferences. And this is something that we teach in our office. We teach other doctors how to do Botox.
Is Botox, I've heard that it's related to botulism, could be a poison. Can you clarify and dispel some of that rumor?
The Botox that we use, Botox cosmetic, is a purified protein.
So it's a protein?
It's a protein. It's highly diluted. And so, like I have told you in the past that we at the most would inject maybe 1 vial. That would be 100 units. I would have to inject 40 vials of this into you before you would feel any effects from botulinum. So it's extremely safe.
It's extremely
Extremely safe. I've never had a problem. And I inject 150 people a month with Botox, and
Right.
I've never had anybody who got sick or ill, or I've had people that have gotten a little bruise before from the needle poke, but I've never had a significant problem.
So in skilled hands, it's a great procedure. We're running out of time now, but thank you so much for coming. It was very
my
interesting,
pleasure.
and maybe I'll be seeing you sooner than later.
Thank
And you
very
know
much.
you'll be seeing me again.
I can't wait.
Yay. Thank you so much.